Back injuries and related strains, sprains, and ligament damage are some of the most common injuries in most industries throughout the world, often within the top 3 reported injuries at any given time. Contrary to popular belief, most back injuries are preventable. That's right, preventable. Many back problems are not the direct result of injury, but are the result of degeneration of the spinal discs. Over the years, through improper lifting, twisting, and bending, these delicate discs become worn and damaged and can cause extreme pain and affect your ability to perform your job and live your life the way you want to. For many years, employees were simply told to keep their back straight while lifting. Ergonomic engineers later determined that a ramrod straight spine was not necessarily the best position for lifting and handling material. It was determined that the spine should not be totally straight, but kept in its natural curvature as much as possible, as shown here. Warnings about bending your legs and not your back to keep those discs in their natural curvature should be taken as very good advice. This will allow the discs to spread evenly across your vertebrae, and pressure on the disc is applied evenly across the entire surface of the disc, not just on one part of it. Use the powerful muscles in your legs to do the lifting, instead of the weaker muscles in your back. However, research into back injuries and their causes and prevention is an ongoing process. The purpose of this training program is to provide you additional information that will take your back injury prevention techniques to the next level. That's why this program is titled Manual Material Handling, Back Injury Prevention, instead of simply Safe Lifting. This is because there is much more to material handling than lifting properly. Lifting is very important, but it is only one step in the material handling process. The material must then be moved safely and then put down properly. Size and weight of the load, balance, travel path, foot positions, height of the object, arm positions, and material handling devices are all important factors that must be considered and put into practice. To begin, it is important for you to understand the basic anatomy of the human spine and back. The human spine is a complex structure and vulnerable to injury, misuse, and the aging process. The back must be mobile to allow free movement, and the spine must be stable so that you can remain upright all day. The ideal alignment of the spine is when the joints in the spine are lined up for easy twisting bending with little friction between the bones, also called vertebrae. The following is a brief description of how the vertebrae, discs, and ligaments work together. Between each pair of vertebrae lies a flat, circular disc. The outer part of this disc is strong and hard. The inner part is soft in order to absorb shock to the spine during any movement. 2 ligaments run the length of the spine and help hold the vertebrae together. These ligaments expand as you stretch your body. There are also smaller ligaments between each vertebrae and also small muscles that span 2 or 3 vertebrae that allow the body to straighten up and lift objects. The abdominal muscles play a very important role in providing much needed support for the back when bending forward or lifting large and heavy objects. Now that we have looked at how the back is constructed, we know that there is deterioration from wear and tear as we age. Add to that the stresses caused by excessive bending, twisting, improper heavy lifting, poor posture while sitting or standing, and a picture emerges of pain and injuries due to spine, discs, and nerve injuries. Many books, videos, and other types of training materials are available relating to back injury prevention. The amount of money spent on treating back pain and time lost due to workplace accidents make this subject a must for any safety training program. That's why you're watching this training program. The primary objective when lifting anything, any size or weight, is to keep your back in its natural curvature. Bending the back pinches the discs and exerts tremendous pressure on one side of these delicate discs, which can cause them to break, tear, or leak. When this happens, you experience back pain. Ergonomics engineers have determined that there is a 10-to-1 ratio of back pressure to the weight of the load you are lifting. Using proper lifting techniques, a load that weighs 25 pounds exerts 250 pounds of pressure on your back. By using improper lifting techniques, that pressure increases 5 to 50 times. For example, holding that same 25-pound load away from your body greatly increases the strain on your back, making 25 pounds the equivalent of 1,000 pounds or more of pressure on the back system. To lift properly, place your feet as close to the object you are lifting as you can. Bend your knees, not your back. Get a good firm palm grip on the object you are lifting, and pull it close to your body. Then stand up, using your leg muscles to do the work. When setting the object down, reverse the same procedure. Here it is again in slow motion. When available, the use of forklifts, pallet jacks, and other lifting equipment can greatly reduce strain to the back when properly used. Here are some important back injury prevention tips for people who work with computers either at work or at home. Keep your keyboard directly in front of you. Keep the screen at a comfortable distance with the top of the screen at eye level so the neck is maintained in a neutral position. Hands and wrists should be straight and not bent forward or backward. An office chair should have adjustable heights, armrest, seat pad, and back. People are all different, and workstations should be adjusted to fit the individual employee. It is important to remember that both the back and stomach muscles need to be rested to ensure a safe lift. For example, if on Sunday you are doing yard work all day, raking and piling up grass, the muscles in your back will become fatigued. When you wake up Monday morning, you are likely to have a stiff back and be a little sore. If Monday's work then consists of repeatedly lifting heavy boxes out of a truck bed, even though your stomach muscles are fine, your back muscles are still fatigued from the day before. The likelihood of a back injury has been greatly increased. It is your responsibility to make sure you are properly rested and ready to lift when you show up to work. We've covered the basics, so let's consider the next level of back injury prevention. Here are some procedures and techniques you should consider before starting any lifting job or activity. It may seem like a lot to remember, but after a short time these techniques can become second nature to you, just like driving a car or riding a bicycle. Check the balance, weight, and size of the load to determine if it needs to be moved by team lifting, a mechanical device, or if it should be moved manually. You may not have to lift much at all. Ask yourself the question, should a hand truck, pallet jack, or forklift be used for moving items distances or where repetitive lifting and moving may be required? Make sure you can see over the load and observe your travel route. Check the route to be traveled to assure that there are no obstructions, uneven flooring, wet areas, or change of levels to prevent slips, trips, and falls. Face the object to be lifted and square off with the face of the object. The angle from which you lift the object is always important. Position your feet so they are comfortably separated, one slightly behind the other, to help maintain your balance during the lift or first movement. Move the object as close to the center of your body as possible. This will allow for good balance and reduce strain. Whenever possible, use a free hand or the front of your legs for additional support when lifting items in awkward positions or when you can't get close to the item. This will greatly reduce the strain on your back, discs, and muscles. If moving an object off a table or waist-high work area, first slide the object toward your body and over to the edge to help maintain control of the object and reduce the amount of lifting work you do. Whenever possible, avoid lifting heavy objects over chest high, as you can easily lose control of a high object. Avoid extending your arms when lifting. Your arms should be partially flexed while keeping the object close to your body. If a turn is necessary while moving the object, turn your feet to turn the whole body instead of twisting at the waist or knee. Sudden movements or jerking motions should be avoided as not to overload or put undue strain on your back muscles. It doesn't take much time to assess the material handling situation and apply these techniques. That's about all we can cover in this short training overview. It is up to each and every employee to apply safe work practices to the job. Your supervisor or trainer will provide you with more specific training and procedures as it directly relates to your unique work environment. Use the techniques outlined in this video. Use common sense and good judgment, and you will be well on your way to preventing painful back injuries. Take the time to handle material safely each and every shift, and don't be afraid to ask for help to accomplish a difficult or awkward lift. Thank you for your attention, and work safely.